aren't usually a sign of anything serious and can often be treated at home. The medical name for nosebleed is epistaxis. During a nosebleed, blood flows from one or both nostrils. It can be heavy or light and can last for a few seconds or 15 minutes or more. What to do to stop a nosebleed? Sit down and firmly pinch the soft part of your nose just above the nostrils for at least 10 to 15 minutes. Lean forward and breathe through your mouth. This will drain blood into your nose instead of back down your throat. Place an ice pack or a bag of frozen vegetables covered in a towel on the bridge of your nose. Stay upright rather than lying down, as this reduces the blood pressure in the blood vessels of your nose and will discourage further bleeding. If the bleeding eventually stops, you won't usually need to seek a medical advice. When to seek medical advice? You're taking a blood thinning medicine, anticoagulant such as warfarin, or having a blood clotting disorder such as hemophilia, and bleeding doesn't stop. You have symptoms of anemia such as heart palpitations, shortness of breath, and pale complexion. Children under the age of 2 have nosebleeds. Your nosebleeds come and go regularly. The bleeding continues for over 20 minutes. The bleeding is heavy and you've lost a lot of blood. You have difficulty in breathing. Swallowed a large amount of blood which causes vomiting. Nosebleed developed after a serious injury such as a car crash. What causes nosebleeds? The inside of your nose is full of tiny, delicate blood vessels that can be damaged and relatively bleed easily. Common causes of nosebleed include picking your nose, blowing your nose very hard, a minor injury to your nose, changes in humidity or temperature, causing the inside of your nose to become dry and cracked. Occasionally, bleeding comes from the blood vessels deeper within the nose. This can be caused by a blow to the head, recent nasal surgery, and hardened arteries or arteriosclerosis. Who gets nosebleeds? Nosebleeds are fairly common and most people will experience them every now and then. Anyone can get nosebleeds, but they most often affect children between the age of 2 to 10, elderly people, pregnant women, people taking blood thinning medications such as aspirin and anticoagulants such as warfarin, people with clotting disorders such as hemophilia, and high blood pressure, hypertension. Are nosebleeds serious? Nosebleeds aren't usually serious. However, frequent or heavy nosebleeds may indicate serious health problems such as high blood pressure or blood clotting disorders such as hemophilia and should be checked immediately. Preventing nosebleeds. Things you can do to prevent nosebleeds are: avoid picking off your nose and keep your fingernails trimmed and short, blowing your nose as little as possible and very gently, keeping your home humidified, wear a head guard during activities in which your nose or head can get injured. Always follow the instruction that comes with nasal decongestants. Overusing these can cause nosebleeds. Thank you.